Hello and welcome to another episode of In Focus. Today's topic of discussion is why India is rethinking its anemia policy. Points of discussion will be background of the news, National Family Health Survey, what is anemia, Diet and Biomarkers Survey, the need for special survey on anemia and practice questions. First of all, moving on to the background of the news, the Union Health Ministry is working on a roadmap of a new methodology to take count of anemia across the country. Questions will no longer be included in the National Family Health Survey because of the concerns regarding its faulty methodology. The prevalence of anemia will now be tracked using the newly launched Diet and Biomarkers Survey, that is DABS. Now let's discuss about National Family Health Survey. The National Family Health Survey or NFHS is a large-scale multi-round survey conducted in a representative sample of households throughout India. It provides granular data at the state and district levels. The NFHS 5, which was conducted between 2019 to 21, showed an unusual jump in anemia levels across all age groups. The number of children having anemia has jumped to 67% as compared to 58.6% in the last survey conducted in 2015-16. The World Bank data shows 1 in 2 Indian women is anemic, 20% higher than the world average. Taking away the data of anemia from the scope, NFHS could prove to be a bad step. The NFHS covered 6.1 lakh sample households across the country, taking blood samples from women and men aged 18 to 49 years and children between 8 to 59 months. To show anemia's prevalence, authorities look at a hemoglobin diagnostic cutoff set by the WHO standards. Now let's understand what is anemia. Anemia is a condition where there is a lack of enough red blood cells or hemoglobin. Reasons for anemia include iron deficiency, deficiencies in folate, vitamin B12, vitamin A, chronic conditions, diabetes, or inherited genetic disorders. There are 5 documented types of anemia. India has recognized anemia as a public health challenge, launching the Anaemia Mukt Bharat or AMB strategy in 2018. The strategy aims to provide supplementation to the last mile, raise awareness levels, and improve diagnostics. In the Union Budget 2023, Finance Minister Nirmala Sitharaman announced plans to create awareness of sickle cell anemia. Other government schemes which list anemia as a challenge includes Integrated Child Development Services, National Nutritional Anemia Prophylaxis Program, and Pradhan Mantri Surakshit Matritva Abhiyan. Although India has increased the iron and folic acid, that is ICA supplement coverage for all age groups steadily, but the challenges run parallel to these initiatives. The challenges include lack of awareness about the causes of anemia, undernourishment since birth, resistance to and information gap around iron folic acid tablets, cultural biases that fuel a lack of agency, and deficient health interventions. A team of Indian researchers in 2021 published a study in Lancet Global Health showing that anemia's case numbers were an overestimation due to a higher hemoglobin diagnostic cutoff set by WHO. Now let's discuss about DABS, that is Diet and Biomarkers Survey. The new Diet and Biomarkers Survey launched in December last year by the National Institute of Nutrition. It will map the diet, nutrition and health status and provide a correct estimate of anemia among urban and rural population using state-of-the-art techniques. DABS is a more accurate technique as it uses the venous blood sampling method. A biomarker survey overcomes the limitations of questionnaires that rely on self-reported dietary intake measurements, which can often be biased. It can more precisely identify persons with specific dietary deficiency in support of medical treatment. A biomarker test for anemia can be used to analyze levels of folate, iron, vitamin B12, copper and zinc in the body, helping trace the cause of anemia. DABS also links a person's nutrition profile with anemia, providing a more comprehensive picture. The sample size for DABS is restricted to 1.8 lakh people as opposed to NFHS 6.1 lakh. Venous blood testing requires trained personnel who are equipped to draw blood, which restricts the scale of the survey. Now, why there is need for a special anemia survey? The experts are worried that the DABS, though accurate, would still not be able to cater to what India actually needs. India needs to monitor district level data closely, identify causes of anemia outside of iron deficiency, and use this data to inform anemia-focused health interventions at the primary level of care. Both DABS and NFHS link anemia to a hemoglobin deficiency, but assessment should ideally go beyond hemoglobin cutoffs and iron deficiencies. There is a need for a special survey for identifying anemia and its causes. Hemoglobinopathy, inherited genetic disorders, and vitamin deficiencies are often overlooked but still require district-level screening and diagnosis. A comprehensive data set can map other common causes of anemia beyond iron deficiency and demographic and region-specific burden. As women are more affected more than men globally, it can also help calibrate targeted interventions. Now it's time for the practice questions. First of all, prelims question. Consider the following statements about Anaemia Mukt Bharat. 1. Anaemia Mukt Bharat is a scheme launched by the Ministry of Health and Family Welfare in collaboration with UNICEF. 2. It was launched in 2018 as part of the intensified National Iron Plus Initiative program. 3. The target groups for AMB includes only children. Which of the statements given above is or are correct? 1 and 2 only, 1 and 3 only, 2 and 3 only, or 1, 2 and 3. And now mains question. The anemia burden of India amongst women and children is a cause of worry. Comment. So that's all for today. Stay tuned for the next episode. Thanks for watching.